So I'm at Candela Medical Head Office today for a little bit of a laser hair removal touch-up under my arms. I've had hair removal with Candela on my lower legs years ago and it worked an absolute treat, but it has been far too long since I've done the underarms. So I'm going to talk to Kirsten Cachia because it has been a long time, so I want to make sure I'm 100% ready for this appointment. She's the clinical educator here, so I'm in safe hands. So I'm obviously getting laser hair removal today, but what actually is laser hair removal and how does it work?
Okay, laser hair removal is the permanent reduction of hair. And how it works is that we're using a specific wavelength that's attracted to melanin to destroy the bulb and the surrounding structures of the hair follicle.
So I feel like I'm ready for my appointment, but what's the checklist? What do I have to make sure I've got ready before my appointment?
Okay, so at least 6 weeks before you come in, you have to stop waxing, threading, plucking, any of those techniques. Then we do ask you to avoid sun exposure for at least 2 weeks on that area that you're about to have lasered. Remove any fake tan that you have on the area, has to be completely clean. You can exfoliate about 2 days before coming in, and then 24 hours before you come in, we ask you to shave the area so it's nice and hair-free. Don't come in with any moisturizers or sunscreen or anything like that.
So it's been a while since I had laser hair removal. What should I expect? How much pain are we looking at here?
Okay, so different areas are more sensitive than others. The face and other smaller areas can be a little bit sensitive. The legs and the arms are usually fine, and we do have 2 really good cooling techniques. One is a cryogen cooling and the other is the air cooling device. So it should be really, really comfortable. I just want to do one test pulse for you, see how you cope with it. 3, 2, 1.
Oh, that's so fine.
Is that okay?
Yeah. The cool bit afterwards is the best thing ever.
Isn't it?
Yeah.
That's the cryogen cooling that we spoke about.
I'm very happy with that.
3, 2, 1. How are you feeling?
Why do I remember this as stinging when it's not stinging me at all currently?
So what's your pain level between 1 and 5?
Oh, not even on a scale.
Wow, that's amazing.
Tough. I'm actually feeling 0 heat.
That's fantastic. And I've actually got the parameters spot on, so 8 joules with a 3 millisecond pulse duration on the Alexandra 755, which means that it's actually working on the root of the hair, and I can see the little follicles have got some erythema, there's a little bit of swelling, so that's my end point. So great, fantastic.
Easy.
Easy peasy. No pain, Gemma?
None at all. Does the fact that I've got fair skin and like brunette hair, is that working in my favour?
It certainly is. Best scenario is pale skin, dark hair.
No one realises how pale I am because I'm usually covered in tan.
It's really lovely to see there's not a speck of fake tan at all. So your preparation has been amazing.
So thorough.
All done.
It'll have a timestamp on this video, but I honestly think that took less than 5 minutes. So we're done. Quicker and easier than I expected. What is the post-care routine? How do I make sure I'm really looking after my skin after my treatment?
Okay, so I've popped the post-laser gel on your area, and that is cooling because it has anti-inflammatory ingredients in there. What you need to do when you get home, if it feels hot or sensitive, pop a cold pack on there and just keep applying that post-laser gel 3 times a day for the next 3 days. You you need to start exfoliating in about a week's time, and you need to do that twice a week, and that's going to help cell turnover and the hairs that we've treated to be purged. And then if the area is going to be exposed to sun, then we would require you to use a 50+ sunscreen and try and avoid direct exposure for approximately 2